We saw the other day a video by Dr. Esselstyn that is the best one I think he's done. And he's so amazing. And he talked a lot about the endothelial cells and how, as we age, which is important to me, we don't produce the nitric oxide that we normally do to keep our endothelial cells healthy and flexible. So we wanted to share it with you. And then I'll let Bill do the talking. I'll talk about the greens, how we can really keep creating nitric oxide as we get older.
Yeah, we'll give you a link to that talk that he gave. What we'll show you in a moment here is him telling a story of a friend of his, a surgeon friend of his, and his episode with these the contraction, the reduction of flow in his heart artery, and how he was able to turn that around. But basically what Connie's talking about, endothelial cells, kind of a big name, but it's basically just these little cells that line the inner core of all of our arteries. And we've got a lot of them. If you take all the endothelial cells in your body and you lay them out just flat, just lay them out, it would cover 6 tennis courts.
Wow, that is amazing.
That's a lot of cells.
Yeah.
And they are what allow the artery, like Connie was saying, to expand and contract. And it's like, so what's the big deal about that? I never think about my arteries expanding and contracting. But what Dr. Esselstyn points out is really important, because it's like if you're running and your muscles need more blood and oxygen to function, you got to pump more blood through those arteries. And so this ability to expand and contract is how the body is one of those like miraculous built-in functions. It has the ability to go from like a garden hose to a fire hose. And the value of that, of course, is like if you're just watering the garden hose is fine. If your house is on fire, the garden hose ain't going to do the job. So when we're running, you know, our house is on fire, we need more water. We need more blood and oxygen. And if we just try to pump the amount of fluid, the amount of blood we need through that little artery, it's going to increase the pressure a lot. Like when you put your thumb over the end of your garden hose, the same amount of water has to go out a smaller opening. The pressure goes up, right? It suddenly will shoot across the street. We want to avoid the high blood pressure that would come with trying to push that same amount of blood through the artery if it didn't expand. So its ability to expand to like a fire hose to get more water through allows the blood pressure to stay down and supply the body with the blood and oxygen that it needs. So the endothelial cells being healthy is really important. And what injures them is fat, particularly saturated fat. And so that's the link that Dr. Caldwell puts with diet and heart disease, is we eat this high-fat standard American diet, and it keeps injuring these endothelial cells. And because of the injury, it starts laying plaque down. That's why plaque is there, is because the endothelial cells are being injured. It's not a, you say it's not a natural thing. It is a natural thing to repair the body, but what's unnecessary, and we could say a little unnatural, is the amount of food, amount of fat we eat that's doing the injury. So his whole point is, his whole career really is built around the fact that if we eliminate the fat in the meat, in the processed foods, we don't injure the endothelial cells, and the body can restore itself. Amazing.
Well, let's take a look.
We'll share our screen here with a segment of that talk that he did, and then we'll give you the link later on. So here's that. Share the screen and start.
Now, this young surgical colleague and friend of mine, Joe Crow, it was in 1996 that at age 44, he began to get chest pain. Now, he was not diabetic. He was not high, did not have high blood pressure. His cholesterol was not particularly elevated. He was he was athletically active, and he had no strong family history. Finally, in October of 1996, he saw cardiology for an evaluation, and the workup was negative. A month later, he finished his surgical schedule and sat down to write postoperative orders when suddenly the elephant was sitting on his chest, pain in his left shoulder and arm. Joe was having a heart attack, and he was whipped down to the catheterization laboratory where the catheterization was started. He had cardiac arrest, resuscitated, finished the catheterization, one more cardiac arrest, and then sent to the floors where he stabilized and was able to be discharged 4 days later, but was very depressed. And the reason he was depressed was at the time of his angiogram, the entire lower 1/3 of his left anterior descending coronary artery was all moth-eaten and diseased over too long a segment, really to get too long a segment to get, you can't ram in stent after stent, and it was too far down the artery for the bypass. So Joe was really depressed about this, and so Ann and I had he and his wife out for supper 2 weeks after his heart attack. Joe, look, you've got the typical Western disease. You've been eating the typical Western diet. We've got 10 years of data. Why don't you think about trying plant-based nutrition? So he said, yes, okay, I'll give it a try. They couldn't offer me anything else, but I'm not going to take those statin drugs. I don't trust them. There's too many, got accompaniment here. There's too many side effects. So he decided he would really become the personification of commitment to whole food plant-based nutrition. And over the next 2.5 years, his total cholesterol plummeted. His LDL went from 98 to 38. And then he had 2.5 years after his heart attack, another angiogram. Now, our offices are together up in the surgical office area. And on the day that I knew he had earlier in the morning had his follow-up angiogram, I went over to his office, opened the door. I said, listen, Joe, I understand you had that follow-up angiogram. Can you share with me, how did it go? Well, he got up from his desk, came around, put his arms around me and said, I think we're doing okay. And I said, well, any chance that I could see the follow-up angiogram? And he said, sure. And that's pretty exciting for us. We suddenly, when you think about it, if the plaque is young and the patient seems to be young, and the plaque is made of inflammation, fat, and cholesterol, the body has an extremely powerful capability of getting those cells out of there and reverse, as we see here.
Okay, so that's what we wanted to share. Great story, and just like physical proof, the capacity our bodies have to restore health. I mean, really, if he hadn't been in that hospital when he had his heart attack, he may have been dead. But he was right there. They just jumped on him. He had 2 heart attacks. He was resuscitated twice. And it's interesting, isn't it, that his cholesterol was within what they call the normal range. He wasn't diabetic. He didn't have high blood pressure. It's like, wow, you wouldn't expect that to happen. So yeah, diet related. It's pretty interesting.
And the key is eating dark leafy greens if we want to have healthy production of nitric oxide and good flexible endothelial cells.
Yeah. So the thing about nitric oxide production, see, the endothelial cells, they produce that naturally. It's a lovely thing. Okay. But as we age, that production, the ability to produce that diminishes. Like when you're 60, I think he said it's 50% less. when you're 80, it's like 70% less. So it gets our attention.
Yeah.
So yeah, what he said is that fortunately there are alternate pathways, biochemical pathways, to produce nitric oxide besides just what's in the endothelial cell. So that is
Dark leafy greens.
dark leafy greens. So yeah, the top 5 are kale, spinach, chard, and beet greens.
Yeah, and arugula.
And arugula, yeah, I can't remember that. I thought I had it, but I don't. Actually, I've got it written down somewhere. But yeah, but any dark leafy green, romaine lettuce, the tops of turnips, the tops
Cabbage.
of radishes, cabbage is great, but we need to get the dark leafy greens in.
And what you want to do is steam them lightly if they need steaming. Arugula, you don't need to steam. And so they're soft and tender, and eat them at least 3 times a day if you don't have a heart concern. If you have a heart concern, he encourages 6 times a day.
Yeah, 6 times a day, and chew them. Don't just blend them in your smoothie. There's something that happens in the mouth. There's bacteria and enzyme in the mouth that promotes this production of nitric oxide. So good to chew it, not drink it.
And then you want to add balsamic vinegar. Why?
Okay. So that's another way that you can increase the production of nitric oxide. Balsamic vinegar releases an enzyme, the enzyme that produces nitric oxide when it's there in our stomachs. And so balsamic vinegar is a great way to dress the greens or your salads or lots of other things, dishes that will, again, help as we age produce more nitric oxide.
So healthy heart, healthy life, eat whole food, plant-based, healthy life, very, very healthy as we testify to it. We love our food. We love this way of eating and living.
Healthy and happy.
Yeah. Now the recipe, we did a wonderful morning salad. It's a Thai salad. So you can have those leafy greens first thing in the morning as your breakfast, or this salad is great for any meal. And it has peanuts, lots of bean sprouts, and lots of veggies. It's really good.
Yeah, and cabbage is the main green, Napa cabbage and red cabbage.
Mm-hmm.
Really tasty. Yeah, we really enjoyed it. So give it a try. Thanks for joining us, and we look forward to seeing you again next week.
Bye.